Good morning, everyone. My name is Ebony Hill, and I am the Provider Relations Field Service Representative for Territory 5. And welcome to the Common Denial session of this year's Fall Medicaid Virtual Fair. Co-hosting with me today is Janie Griffin, who is the Provider Relations Field Service Hospital Rep for South Georgia. And also joining us on the call today is Debbie Smiley and Bridget Drumright from the Department of Community Health. And just a few housekeeping rules before we get started. All lines will be muted upon entry unless you are a panelist or a speaker. And just to ensure the best possible call quality and bandwidth, we ask that everyone please disable your videos. This session is being recorded and it will be posted to the DCH YouTube site. And if anyone has any questions during the presentation, please enter them in the Q&A box and they will be addressed at the end of the presentation. Okay, so we're going to go ahead and get started. And on today's agenda, we're going to go over common eligibility denials, common procedure code denials, common hospital denials, common miscellaneous denials, how to contact Gainwell Technologies, and then closing and answers. I'm sorry, questions and answers. Okay, so some of the common eligibility denials. Now, the most common eligibility denial comes from not checking the member's eligibility. Now, over the last 3 months, there have been more than 500,000 eligibility denials. Okay, so now this is the screen that you will see when you go into the GAMIS web portal to check eligibility. Now, some of the search criteria combinations that you can use to check eligibility would be the Medicaid ID number with the date of service span, or you can use the last name, the first name, the gender, the birth date, and the date of service span, or the birth date, the social security number, and the date of service span, or the last name, the first name, the social security number, and the date of service span. Okay, so some of our common eligibility denials include edit 2003, which is member ineligible on detailed date of service. This edit is triggered when the claim detailed date of service does not fall within or are equal to the beginning and ending dates in any recipient eligibility segment. We also have edit 2078, which is member has partial eligibility for detailed date of service. This edit is usually triggered when only partial eligibility was found on the detailed date of service. And we have edit 2017 or 2019, which is member services are covered by CMO plan. And this is usually triggered when a member has a lock-in segment with one of the CMOs, which is WellCare, AmeriGroup, Peach State, or CareSource. Okay, we also have edit 4021, and this is no coverage for bill procedure. And edit 4924 and 4925, which is diagnosis not covered for benefit plans. Now, these edits are usually triggered if a member's benefit plan coverage rule is not found. Now, for these, the method of correction would be the eligibility, first of all, should always be verified prior to rendering services to a member. In this example, the member has Slim B coverage where Medicaid will only pay the Medicare premium. Therefore, the member does not actually have Medicaid coverage. And please note that aid categories 661 through 663 plans only cover the member's Medicare premium. These edits are commonly used for these aid categories, but are also used in other circumstances. So verifying eligibility is your best way of knowing. Okay, and we also have edit 2504, which is member covered by private insurance with no attachment. Now, this edit is triggered most of the time when a member has private coverage and it is not exhausted using the header from date of service through date of service span, and there are no claim attachments, and the TPL amount on the claim is 0. Now, the method of correction for this denial would be to verify the COB information and bill the claim to the appropriate insurance carrier first, or to resubmit your claim with the primary carrier's EOB information, or resubmit your claim with the DMA 410, which is the COB notification form. So we always know that Medicaid is always the payer of last resort. Okay, so effective February 23rd of 2017, the DMA 410, which is the EB TPL form, will need to be submitted via the GAMIS web portal when updating a member COB information. To provide this information, upload a scanned image of the member's insurance card for COB updates to the GAMIS web portal, and then perform an eligibility request for the member in question. Select New Member Transactions button and follow the instructions provided on the Member Transactions page. And please note that providers need to continue using the paper DMA 410 form for Section 1, which is co-payment notification, and Section 2 for COB non-coverage affidavit. Okay, so some of our common procedure code denials. So the number one most common procedure denial comes from not performing a procedure code search. Now, this is the procedure code function. Now, to access the procedure search function, you would need to be logged into the web portal and go under the providers tab and then under procedure search. And then this is the field that you will see that you would need to complete. Okay, so it calls for the procedure code date, and then the place of service. And as you can see here, after the procedure code and date of service and place of service is entered, all of procedure information will populate. So you're going to have the procedure code, and it will also let you know if there is a prior authorization that is required for that procedure code. And then at the bottom, it will tell you what categories of service can actually bill this particular procedure. Okay, so one of our common procedure code denials is edit 4013, which is procedure not allowed for service date. And this edit is triggered when the date of service on the claim is not within the effective dates and end dates on the procedure restrictions table in GAMIS. Now, the method of correction for this denial will be to review Part 2 program-specific manual to determine what codes are billable and check the procedure search function to determine the billing rules for this code. The next edit is 4032, which is procedure code not on file. And this edit is triggered when the line item procedure code on the claim does not exist on the reference database in GAMIS. And the method of correction for this would also be to review the Part 2 program-specific manual to determine what codes are billable and also check the procedure search panel to determine the billing rules for the code. Okay, we also have edit 4257, which is modifier restriction for procedure billing rule. And this edit is triggered when the claim modifier does not meet the procedure billing rule modifier configuration in GAMIS. Now, the method of correction, as always, is to review the Part 2 program-specific manual to determine what codes are billable and also check the procedure search panel to determine the billing rules for this code. The procedure search results will show the applicable categories of service, the associated modifiers, the claim types, the age restrictions, and if a PA is required. So once reviewed, you can submit or resubmit the claim. And in this example, the modifiers can be corrected on the GAMIS web portal. Okay, another edit is 4801, which is billing rule not found for bill procedure. This edit is triggered when there is no billing rules for the procedure under the provider contract for the date of service in GAMIS. You also have 4871, which is claim type restriction on procedure billing rule. And this is triggered when the claim type is not within the claim type restriction on the billing rule for the procedure code in GAMIS. And also with this one as well, the method of correction is to, of course, verify this information in the Part 2 program-specific manual to determine what codes are billable and also check the procedure search panel to determine the billing rules for the code. The procedure search results will show the applicable categories of service, and this was also mentioned in the previous slide, but the associated modifiers, the claim types, the age restrictions, and if a pre-cert is required. So with this being said, you can see definitely how important it is to do the procedure search panel because it does give you a lot of information and it will, help with, not having as many of these, procedure code denials. So just verify that procedure search panel. Okay, the next edit is 4316, which is the diagnosis restriction for bill procedure. And this is triggered when the diagnosis is not allowed for that bill procedure. So the method of correction for this one would be to review the diagnosis associated with the procedure in question, correct the diagnosis code if applicable. If the diagnosis is correct, your claim has denied because the procedure you are billing is only payable for certain diagnosis codes. Okay, now we're going to go over some of the common hospital denials. So I'm going to turn it over to Ms. Janie Griffin, and she is the provider relations rep for hospital services for South Georgia.
Thank you, Ebony. Good morning, everyone. If you would proceed to the next screen, please. One of the common denials we have that pertain to the diagnosis codes is with Edit 4039, which states diagnosis cannot be used as principal diagnosis. This edit is triggered when the diagnosis code on the claim is not allowed to be used as a principal diagnosis code. You have the example at the bottom, and it's showing you the diagnosis code of the 034219. That's listed as the primary. If you go to the next screen, please. On this screen, you are now able to see to where it's stating that that one is not a primary diagnosis code. So your method of correction on this would be to get with your coding department or your medical records, charge master department, and review the diagnosis to assure that you have the correct one on the claim. Once they've given you the proper diagnosis code, then you will resubmit your claim with that appropriate code. Next slide, please. The next edit that you see here, and everyone is familiar with this, pertains to the inpatient Part B only claims. With the inpatient Part B only claims, you will have multiple edit codes on there. However, the edit code of the 1770 will always be there with these, and it will give you the second one along with it. So the edit code of 1770 indicates inpatient Part B claim requires an EOB attachment. That will be there, but it's also going to let you know either edit code 1771, 72, 74, 75, 76, or 77 is going to give you more detailed information. Such as 1771 is indicating that the payment amounts is not correct, and you need to submit that over to us. 72 is the same thing, but it's pertaining to the Medicaid one. 1774 is saying that the attachments are missing for one or the other. Normally, we recommend to the providers always do process of elimination. Have your EOBs as well as your DMA 460, and always make sure that you are including all of your EOBs from Medicare as well as Medicaid. Next slide, please. Okay, so as I stated, your method of correction would be to attach the required documents to the inpatient Part B only claims. However, we do need for you to keep in mind that even if you should receive a zero payment from Medicaid, you still must attach that to the inpatient Part B only claim. These EOBs is one of the specific requirements that makes the claims inpatient Part B only. Should you still need additional information on that, please refer to the inpatient Part B only presentation that is available for you on the GAMIS portal. Provider information, provider notices, and it is titled the Hospital Inpatient Part B Only Presentation, and that was posted August of 2020. Next slide, please. So we're going to talk a little bit about the partial eligibility edits that you receive on some of your claims. Edit 2078 indicates member has partial eligibility for detailed dates of service. This edit is triggered when only partial eligibility was found on the detailed date of service. We provided an example for you, and the example is stating that the member was admitted into the hospital as a Medicaid member. The member's primary insurance effective date occurred after the date of admission. The Medicaid eligibility effective date was January 1st of 2021. However, the primary insurance effective date is January 15th of 2021, and the patient was discharged February 17th of 2021. You as a provider, your method of correction would be to submit the claim to the primary payer first. You will submit the claim over with the effective date through the end date. Once you've submitted that over, then you will send it over to us as a secondary. However, please remember that you must obtain an authorization. Authorizations are required for your commercial, your TPL payers. The only ones that do not require an authorization is when it's pertaining to your crossover claims or if it's due to labor and delivery. Okay, so I need for you all to remember that. Once you've obtained the pre-certification for Medicaid, you're going to bill that entire claim from the date of admission to the date of discharge. You will also need to attach the EOBs from that primary payer, as well as entering the amount that that primary payer has paid on that claim. Submit it over to us that way, and your claim should process accordingly. Next slide, please. The next thing we want to talk about is Edit 3050, procedure code and claim not on PA file. So this edit is triggered when providers receive multiple authorizations due to the location that services are being rendered. We're running into this a lot. So your method of correction for this type of denial would be the claims must be submitted separately. Each claim should contain the services related to that authorization. One of the claims will pay, the other claim will deny as a duplicate. Once that claim denies, you would have to submit the DMA 520. Once you submit the 520, you need to indicate on there that the claim has denied due to, or a claim denied stating that it was a duplicate. This was not a duplicate claim. Member received multiple authorizations for the same data service. So I want to share with you all an example of exactly what type of claim we need to see in a situation like this. So we're going to use an example of January 1st through January 30th. And these are basically your recurring accounts that has this type of problem. Your from and through dates of service is saying January 1st through January 30th. However, your detail line for that member state is saying January 2nd through January 5th. Okay, that's one of them. And then your next claim that you submitted is saying January 6th through January 10th. But because they're recurring accounts, normally providers will bill for that entire month. You can stop this type of denial if you bill your from and through dates of service to match your detailed dates of service. You would not have this type of denial. This type of denial should only be given if you have multiple authorizations for the same date of service. Okay, so I hope that helps you all to submit those and get that type of edit taken care of. Next slide, please. So we're going to talk a little bit about the common miscellaneous denials. Next slide, please. Edit 1002, rendering provider not eligible to render services. This edit is triggered when the rendering provider is either not enrolled for the detailed dates of service span or is not enrolled in an assigned provider program category of service. Your method of correction for these type of claims would be to verify the provider's contract effective date, as well as the demographics for where that provider is housed. Also, we need for you to be mindful of if a provider is suspended or terminated, services will not be reimbursed for payment. If the determined provider file is suspended, the provider should send in the COI form request and reactivation of the account. However, if the provider has terminated, the provider would need to submit a new enrollment application. And that is really important for you all to know that. So if you don't follow those steps, you're not going to receive your reimbursement. And just FYI for you all, we are now going back reviewing the revalidations for providers. So make sure that your provider information is correct. Next slide, please. Edit 1823, header attending. The first provider cannot OPR. This edit is triggered when the attending provider is not active for the category of service that they are submitting. So the screen is showing you where your denial would be. This is always going to be a header denial, meaning that claim is going to stop just as soon as it hit our system if Dr. Brown is not enrolled in services. Next slide, please. So the method of correction for that would be to verify the provider's contract category of service by the demographic maintenance panel. Once again, if a provider is suspended or terminated, services will not be reimbursed for payment. If the determined provider file is suspended, the provider can submit the COI, request and reactivation. However, if the provider has terminated, the provider will need to submit a new enrollment application. So for your OPR, we have a couple of tidbits down there for you with that, but always be mindful to know that in order for you to be OPR, you do not have to be a provider that's billing claims. You just have to be enrolled in the program. Okay, and you can find this information out under the Part 1 Policies and Procedures for Medicaid. Next slide, please. Common service limit denials. You received the denial edit code of 6259, which is calendar year office visits exceeded. This edit is triggered when the member has exceeded 10 office visits within 1 year. Your method of correction for that would be to verify the data on the claim that was captured correctly. And always note, you're going to verify that under the member's eligibility on the GAMIS web portal service limits panel prior to rendering the services for this member. Please be advised that the 10 allotted office visits are shared amongst multiple providers, with the exception of providers that have obtained an individual prior authorization for additional visits. So if you're not going on that member's eligibility screen and this patient has been to Dr. Ebony, Dr. Sharita, Dr. Janie, and everyone else, and those visits has been used up, but you're billing for additional services, you have to go to that member screen to be mindful of how many services has already been rendered. Next slide, please. edit code 5646, 5042, 5048, which is exact duplicate. This edit is triggered when claims has the same member's information, same data service, procedure codes, modifiers, and the provider ID number as history in the claim. Your method of correction for this would be dealing with the 1500. If all of this is the same, there's no correction is needed. Claim is an exact duplicate of a claim history in the file. So you need to search the claim panel with the member ID number, data service, and claim type to locate the paid claim in history. If you cannot locate the paid claim, then that is when you need to contact Gainwell Technologies under the provider contact information. However, keep in mind, if this is a hospital claim, because the example you see here would be a little bit different than that actual hospital claim. So with the hospital claim, you'll do just as we said previously. Go back and look and see if it denied as a duplicate due to the multiple authorizations. If it was due to the multiple authorizations, then you follow the actions that we provided. If it's not due to multiple authorizations and it really is the same data service and everything is valid with the same provider ID number, then the denial is correct. Next slide, please. Timely filing, 90 days, 180 days, 365 days. We talk about this all the time. Next slide, please. Your edit codes 512 and 545 pertain to timely filing. These edits are triggered when a claim is submitted outside of the 6 months or 1 year time frame. So your original claim submission has to be submitted within 6 months from the date of service. Your claim adjustment has to be submitted within 3 months from the month of payment. You can only adjust a paid claim. You cannot do an adjustment to a claim that has denied. Claim resubmission timely filing would be 3 months from the month of the denial. Your crossover claims as well as your TPL claims are 12 months from the month of service. And the last one that you need to know about pertains to retro eligibility. You have 6 months from the date that retro was approved for that member. A claim is considered a new claim if there are any charges made to the claim after the initial submission. And when we're talking about that, we're talking about how you go out there and you may change your total charges. When you originally submitted the claim 5 months ago, your total charges was $25,000. Now it's 7 months that the claim has been out there and no other resubmission was done to it. Your claim now is showing $20,000. That's a whole new claim and it's considered to be untimely. Your dates of service, when you're changing that, as well as your revenue codes, procedure codes, things of that nature. Okay, if you're changing all of that within that time frame, it's a new claim. So therefore, the 6 months for timely filing will apply to the claim that has been edited, regardless if the prior submitted claims were kept timely in the system. So that is why I pointed that out to you all. If you're changing those charges, dates of service, it's a whole new ball game. Next slide, please. So we have an example here for you where we're using the edit codes of 515 for the detail and 516 for the header. The example is showing that the date of service on the claim was July 1st, 2020. Original submit claim, the denied date was December 30th of 2020. Your first resubmission for an adjusted claim within those dates would be by March 31st of 2021. And the second one would be by June 30th of 2021. This is your 365 days total. All claim submissions and adjustments to denied claims are to be completed according to the policy by the 365 days. Other timely submissions and resubmissions or system edits will remain in GAMIS according to the policy. And there is no time limit for adjusting a claim that reverses payment back to the Department of Community Health. So please refer to the Georgia Medicaid Part 1 Policy and Procedures Manual, Chapter 200, for the timely resubmission policy outlined in Section 204. This will still be enforced to include this new 1 year or 365 days guideline. So we posted this banner message way back when, which you see at the bottom. It was April 12th of 2018. And just to put a pinpoint there for 1 minute, when you're doing these type of claims, you may run into some claims where Medicare is going to take their money back after the timely filing. Then that is when you would go out there and you would submit that information on a 501. So Medicare sometimes can go back 2 years later and say, hey, Sharita Bentley did not have our coverage at this time, so they're pulling the money back. When you run across claims like that, you need to submit the DMA 501, and that 501 has to be submitted hard copy, and you avoid it, and you will attach all of your EOBs. So that's different than what you see here with your timely filing submission. Just wanted to give you all that tidbit of information as well. Next slide, please. Okay, so with the information we've provided for you, we want to make sure working your denied claims, we have a couple of tips for you. Reviewing, correcting, and resubmitting denied claims is central to your revenue management. Assign dedicated staff persons to denials if possible. Document receipt of denials, reasons for denied payments, and deadline for the resubmission. Always review your denial reasons. Read once, read twice, read it until you can understand it. Okay. We began to start seeing a lot of the CTNs where providers are submitting them in and they're saying, can you tell me why the claim denied? And when you look at that, it has on there, claim denied due to no PA, claim denied due to duplicate. You have to read the denial and then do the research. If the denial is invalid, then you contact us and let us know, and we can go ahead and follow up. However, if it's something that you need to correct, go ahead and correct it and resubmit it the right way. Make corrections involving missing or inaccurate information is where we're trying to guide you. Review your clinical reasons for your denials as well. The service, the diagnosis, the procedure codes, procedure code modifier invalid. Utilize the procedure search panel. See if that modifier is listed on there. If it's not there, see if we have the 0 on there to say that you can bill it without it. If there's another valid modifier that you can use with that code, it will indicate it on there. Okay, utilize that procedure search panel. If it's due to you submitting medical records, please note that your medical records that's required, hysterectomy, sterilizations, abortions, EMAs, observations, things of that nature, those clinical documentations must be submitted with the claim. If you do not send it with the claim, it's going to deny, and that is what it's supposed to do. So always think about process of elimination. Make any corrections possible and resubmit your claims in a timely manner. Denials equal revenue delay and revenue loss, and we both know how important that is. Next slide, please. So hopefully now you all should know how to avoid some common eligibility denials by utilizing the members verification panel. You should know how to avoid some common procedure denials by utilizing the procedure search panel. You should now know how to understand and correct these common claim denials, as well as the common hospital denials. Next slide, please. This is the screen that we're showing you for the field territories. Next slide, please. For each territory that Gamewell provides is based on regions, and you have reps. For the reps that handle everything outside of hospital, you see their name listed, as well as myself and Mrs. Bentley's name that's listed for hospital. So you all are blessed with 2 reps. Use them. Next slide, please. If your reps are unavailable and there's high things that you need reviewed, or escalations, that's the word I was looking for, that you all may have trouble with, we have 3 fantastic consultants that are there to assist us at any time. And those are the names that you see there. Next slide, please. We're also providing you with the phone number to where you can contact us for the IVRS review. Utilize this phone function and utilize the options that are there for you. One of the things that I tell my providers all the time, this should truly be your first point of contact, because some of the questions that you all may have, or your concerns that you may have, you may be able to get that answered immediately. So call the contact center at the number that you see, select your options. Next slide, please. We're available to you Monday through Friday from 7 a.m. to 7 p.m. However, the web portal is available 24/7. Next slide, please. Thank you so very much. We really hope that this was beneficial for you. Now I'm going to turn it over to Ms. Sharita Bentley, who will review any of the questions that you all had and provide you with some answers. Sharita?
Good morning, everyone. We will try to address all of the questions in the Q&A panel. DCH, please feel free to jump in and answer any questions that relate to your specialty. I will begin with the questions that you all entered upon registration. The first question is, are sports physicals covered? If you would like to know if a sports physical is covered, please utilize the procedure search panel via the GAMS web portal. Enter that procedure code for that sports physical. The procedure search result will show you the applicable category of service, associated modifiers, the claim type, the age restriction, and if that physical requires a PA, The second question is, are there changes to the manual regarding outlier denials? No, at this time, there aren't any changes with the manual in reference to outlier denials. If you would like to reference the manual for the outlier process, please reference the Hospital Service Manual Part 2 under Appendix L. Next question, how to resolve when patient eligible for other coverage. Please keep in mind, Medicaid is always the payer of last resort, so you must bill that primary insurance first. That's how you will resolve that. You must bill that primary insurance first. Next question. I'd like to know reasons why claims are denied in general, and who do we call to gather more information. If there's a website to visit to enter claims instead of using the 1500 forms. This must be a new provider because everyone should know that your first method of contact again is the contact center at 800-766-4456. If there's no resolution when calling the contact center, you may then create a contact us to your field rep via the GAMIS web portal. You may also key your claim through the GAMIS web portal if you would like to do that. Next question. If Medicaid has an incorrect date of birth, is there anything the provider can submit on behalf of the member to have this corrected? Unfortunately, no. The member has to update that information, or the person's defects caseworker can also update that information. But you all can't send anything that will be useful for us to update the information. It has to be updated by the member or the defects caseworker. Next question, tips on preventing denials. At the end of the presentation, there are tips on denials, so please go over those tips. Jana did read those tips to you all. So once you pull this presentation, you can go over those tips yourself. Next question, what to do once a resident is denied? How to get them approved when you know they do not have funds to pay private. Sir, we cannot determine eligibility. You must contact the local defects office. Next question. Why is hospice claims denied so many times before payment? The primary reason for the denials with hospice claims may be due to the information has not been updated with defects. So make sure that information is updated with defects, and you should not have those denied hospice claims so much. Next question. Why provider not receiving the true denial from 3359 via web portal? We have to contact customer service to receive the outcome from GMCF. Please keep in mind, if you all are uploading information to the claim itself, you will not receive any information from GMCF on that decision. You will have to call the contact center and ask for the notes from GMCF at the bottom of the claim. If you all submit a DMA 520A, that's when you will receive a response from GMCF. But keep in mind, if you're uploading information to that actual claim, you have to call to get the notes that GMCF has provided. Next question. Is there an updated process for multiple authorizations on the same date of service? Unfortunately, no, not at this time. Janie did go over that process, so the process remains the same. Next question. If we have obtained an approved authorization for procedure and the claim denies for auth units exhausted and the surgeon used the facility's auth units, what recourse do we have for payment? At this time, there is no recourse. You will have to reach out to a GMCF. You can call the contact center, and I think it's option 5, and you will have to discuss that with them, or you may appeal your claim via the provider workspace section on the GAMIS web portal, or send them a contact us. All right, the last question is, when Medicare pays, then recoups a payment, and Medicaid secondary gets denied for timely filing. Sorry. Janie did go over this as well. This is when you will utilize the DMA 501 adjustment form. When you fill out this form, make sure you fill it out completely and mail it to us, and we will do the adjustment on our side to avoid the timely filing denial, because you all don't have you all do not have any recourse as to why Medicare has taken their money back, so there's nothing you all can do on your end. And if you try to submit that claim, it will definitely deny for timely filing. So please utilize the DMA 501 form. Okay, at this time, we are unable to answer the questions in the Q&A panel. Therefore, we will answer all of the questions and post the questions and the answers on our GAMIS web portal within 2 weeks. So we would like to thank you all at this time for joining the Common Denial session. And please enjoy the remainder of your day. Thank you so much. Bye-bye.